Welcome to CVS Health Live, an ongoing series that delivers timely perspective and insights around leading healthcare issues happening now. In 2014, CVS became the first and remains the only national retail pharmacy to remove tobacco from its stores. To align with this important decision, in 2016, we launched Be the First, a 5-year, $50 million program designed to deliver the first tobacco-free generation. I'm so proud to say that we have met and surpassed all of our key goals in this initiative. We've contributed $55 million, reached more than 15 million youth, and saw a 36% decline in new youth smokers since we embarked on this journey. We've accomplished all of this by working with the nation's leading tobacco control and youth-serving organizations to support education and awareness, advocacy, and healthy behavior programming. We're delighted to have 3 of our partners with us here today to talk about the issue. First, we have Dr. Bonnie Halpern-Felscher, a professor of adolescent medicine and pediatrics at Stanford University, and the founder and executive director of the Tobacco Prevention Toolkit. CVS Health Foundation has provided funding for the toolkit over the last several years to expand it, and it provides great resources and activities for schools to use. Next, we have Robin Koval, the CEO and president of the Truth Initiative, the national public health organization dedicated to achieving a culture where all young people reject smoking, vaping, and nicotine. And we're also honored to have Dr. Sue Tansky with us today. She's an e-cigarette faculty spokesperson for the American Academy of Pediatrics, as well as an associate professor of pediatrics at Dartmouth. We're currently working with the American Academy of Pediatrics on a clinical education and training program for screening and cessation services around e-cigarettes. Thanks to all of you for joining us today. I'm looking forward to the conversation. When we began Be the First in 2016, e-cigarettes had not yet become popular with young people. However, things quickly changed, and we had to pivot our efforts and energies to address the alarming rate of e-cigarette use among young people. And while the current data shows that fewer youth are using e-cigarettes, we know that there is a growing number of folks that are becoming much more addicted to these products and using them much more frequently. So let's start off with you, Bonnie. Help us understand the changing e-cigarette use patterns that you're seeing. And while there is an overall decline in e-cigarette use, as I noted, there is in fact an increasing amount with 18 to 24-year-olds. Can you help us understand the evolving behaviors here?
Sure. Thank you, Eileen, and thank you so much for having me part of this panel. You're right. In the most recent 2020 NYTS data, the National Youth Tobacco Survey data, we did see a reduction in adolescent, particularly middle and high school students, vaping use, where it went to about 20%. Whereas in 2017, 2018, we saw between 20 and then almost 28% of adolescents reporting past 30-day use. So we are seeing some decline. It's important to say, though, and in fact, our own data showed that a number of youth during this time are reducing their tobacco use. That's great news. What we're finding, though, is those who are the most addicted are the ones who are continuing to use e-cigarettes. And that's the most concerning, that we're seeing such high levels of addiction. We also have to realize that the data that have been most recently collected in 2020 are during the time of COVID and e-cigarette and vaping associated lung illness. So those numbers may continue to decline, which would be great, but we may see them increase again when we're not talking about lung health. We're not talking about the current diseases, so we'll see. In terms of young adults, you're right, we are seeing an increase in vaping amongst our young adults. Now, it's important to realize that young adults today are 18 to 24. They were the 16 to 19-year-olds a few years ago who are most exposed to e-cigarette advertising. So what we may be seeing is a combination of onset of vaping, but also just continuation from their adolescent years.
Great. Thanks, Bonnie. And Robin, there's a lot of misconceptions out there around vaping products and confusion about which products contain nicotine and those that have adverse health impacts. Can you provide some clarity here?
Yeah, thank you, Eileen, and thank you so much also for having me on this panel. There is a lot of confusion. We know from research we did a couple of years ago that 2/3 of young people that we surveyed didn't know, for instance, that Juul, the most popular e-cigarette, always contains nicotine. They're confused. They think because this is what they read on the, see on the internet and see on YouTube, that it's just fun flavors, it's water vapor and flavors, which of course couldn't be further from the truth. And even when they may know that there's nicotine, they have no idea how addictive these products are. Other research that we've done has shown that nicotine levels since Juul was introduced have increased so that the current e-cigarettes now have twice the nicotine that earlier versions had. So these products are really addictive. So there is just a great deal of confusion among young people and among parents as well. In other research that we've done with parents, they can't even always identify what these products look like. So even in terms of trying to monitor what's going on with their kids, they don't always know what a Juul even is.
Thanks for that, Robin. Now, the Truth Initiative has played a critical role in reducing youth tobacco use and over the last decade. What societal or cultural factors do you think might be playing a role in this trend?
Well, of course, the normalization of the usage, the fact that young people don't understand how addictive these products are, and they can consume almost without control. With a cigarette, there's a dose. Right? You smoke a cigarette and then you don't smoke another cigarette for some period of time. Plus, there aren't many kids who can smoke a cigarette in a classroom or smoke cigarettes in their home. Vaping, it's easy to conceal, and you can pretty much use it at will. I think another thing and of course, they think it's cool, it's techie, the flavors, all of that. But I think the other thing that's contributed, especially as COVID has happened, is some of that, it's cool, it's hot, it's new, it's fun, has even morphed into, I needed to reduce stress. These are very stressful times. And what a lot of young people don't realize is some of that stress that they're feeling is actually withdrawal from nicotine. So that there's sort of a perverse understanding there. They think nicotine and vaping helps them reduce stress when actually it's increasing their stress.
Given now just the emerging set of data that's linking vaping with the COVID-19 infection. Sue, COVID-19 isn't the only consideration, but what do we need to know about e-cigarettes and their use that are different for kids as it is for adults?
Well, first of all, I want to frame us and talk about adolescence. When we're talking about youth, we use the term youth and teen and adolescent all fairly interchangeably, because adolescence from a pediatrician's perspective is a developmental stage that starts around age 13 and doesn't finish until you're in your mid-20s. So that's a very unique period of time where there's a lot of really neat stuff happening in your brain. Your brain is developing very quickly. It's becoming faster and more efficient. And it also is really susceptible to addiction. If you leave a brain alone and you don't introduce any chemicals during this important period of time, you're probably going to be okay. And yet this is the period of time where our young people are trying it for the first time. And it doesn't take very many doses for your brain to become habituated and to really decide that it needs this drug. And so most of the time when we're talking about e-cigarettes, we're talking about nicotine, but all these vaping products can have other drugs in them as well. And so there are many products that have CBD in them, or cannabis or marijuana and its other designs. And those are also significant issues. So most of the emphasis that we've been placing has been around nicotine, but a lot of times the kids have no idea what's in it. To Robin's point, they don't know that it has nicotine in it. They may not know it has other substances in it. And there is no such thing as a safe vape. And even if it just has flavor in it, that also is not safe. These are really drug delivery devices, and they're really poorly regulated, and they're very different. Looking at a Juul, which is a very small product, versus a tank system, there's a lot of technological differences between those, and they change the product that goes into them. So you can look at a label and say it has nicotine and propylene glycol and fragrances and flavorings, but then once you heat it to temperature and breathe that vapor into your lungs, it's very different chemically than what's written on that label. And those chemicals that go into your body are different also based on the device. So there's a lot of complicated stuff, and few people really understand all that stuff that's going into your lungs. And the unfortunate thing is the majority of these products are not known at all to be safe for vaping. There's just no studies. We don't have data in the short term or long term. It's just starting that we're getting some of this data. And there's a lot of cause for alarm for many, many of the flavors. And the flavors, as Robin was mentioning, are a really big driver of young people trying them. They try them for the flavors and they get hooked on the nicotine. And then they continue to use the products, as Bonnie was saying, more and more. And now we've got a population of 18 to 24-year-olds who are pretty intensely using a lot of these products. This is really a youth-focused product. From the marketing and the use patterns. And it's really a significant cause for alarm, even while we're seeing these optimistic numbers where it looks like things are looking a little bit better, at least as far as we know during the pandemic.
Yeah, I mean, the flavor categories, whether it's creme brulee or vanilla or creme de menthe or any of the other flavors around the fruit flavors are pretty intentional. So I think what you said that stood out for me is there's no such thing yet that we know of a safe vape. So I think that's critically important. Bonnie, I know you have a point of view here. We know that there are health risks associated with e-cigarettes, but the research has emerged around this link between vaping and COVID-19 risk. Can you give us a little thought on that?
Absolutely, I do. Thank you. And if I may, I also want to comment on one thing that Sue said that I thought was important and want to put in context also in terms of the rates, which is, even if our rates are going down to so-called 20%, 1 in 5, that's still the numbers that we had in 2017 when the FDA commissioner, the then FDA commissioner and the Surgeon General called this a vaping epidemic. So even with the lower numbers, they're still way higher than what we should be having, especially given the health risks. So around COVID, you probably know that we published a paper a few months ago showing more of an epidemiological link between those who use e-cigarettes as well as cigarettes and the likelihood of being diagnosed with COVID, a pretty significant chance. And, I think there are a number of things to think about here to explain this. One is lung damage. We know, or there's some early evidence emerging that vaping does influence the immune system and the lungs. And we also know that the lungs, we talk a lot about brain development, as Sue rightly pointed out, and I talk about that a lot, but there's also lung development. Our lungs continue into our 20s as well. And, anything that we're introducing into our lungs, whatever it is that we're heating and burning and breathing in, aerosolizing into our lungs can be harmful. So part of it may be that if you're using a vaping device, that you're hurting your lungs and therefore more susceptible to COVID. But it may be behavioral. It may simply be that, when I vape, even though I'm outside, I take off my mask and therefore exposing myself, and the hand to mouth, touch a doorknob, touch my vaping device, put it in my mouth, I'm exposing myself more to the virus. There's also the question of whether that big plume of aerosol, there's some thinking now that because the COVID, the virus is also, the coronavirus is also transmitted through droplets, that it could also be in that aerosol. It's aerosolized as well, the virus, and maybe transmitting either to yourself that you're breathing in deeper or to each other. So there are a lot of concerns, and there's more research coming out, not just ours, really showing a link between both the onset of COVID or being diagnosed with COVID, as well as certainly severity. So I think youth need to get that message and are starting to get the message about lung health and how important it is during these years to stay healthy.
Excellent points. And the behavioral part is something I hadn't really thought of, but that idea of just that type of, taking off your mask and working on it, touching things and things like that, that's really important to think for young people. It's not something that's top of mind. Let's switch topics a little bit because we have a tight program. But when we think about vaping and the opportunities that CVS Health and investing in Be the First and with all of you in terms of partnerships, one of the key learnings I found was that the power of partnerships and the value of collaboration in achieving success. And each one of our partners has brought considerable expertise and programming to the issue of youth engagement around cigarettes and vaping. And I would say that one of the things that is most important is what's clear in all of this is that there needs to be a multi-dimensional solution that embraces many stakeholders, including parents and healthcare providers. And I know all of you feel that way. This is one of the things that was so important, I think, about tobacco control and the vaping issues. There's so many folks coming together to really achieve success. And Robin, let's start with you on this. Can you just explain some of the initiatives that are underway in your shop to address the issue?
Sure. Well, we have, for the past 2 years, shifted our focus to really pay full attention to vaping. You know, cigarette smoking, it took us 20 years to get from, 23% of kids smoking down to less than 4% now. So we have turned fully to vaping. Of course, the Truth Campaign has been focusing on vaping. That's our big public education effort. And the good news there, I'm happy to say, is we are now starting to see with the Truth Campaign shifts in youth attitudes about vaping, social acceptability, risk, et cetera. And we're also starting to see intention shift about willingness to quit. So that's good news. I think part of that shift beyond what we're saying in the Truth Campaign is also due to the fact that almost 2 years ago, we introduced the very first quitting program for young people designed for them to help them quit vaping. It's called This Is Quitting. We now have over 250,000 young people enrolled in this program. Big thank you, of course, to CVS for all your help in helping us promote it. And also, we have, with help from CVS, the very first randomized trial of any, not just youth-focused, any quit vaping program. It's out of the field. We're finishing the analysis of the data. We hope to be publishing the beginning of the year. I can say this at least this much now. We're very encouraged by what we're seeing. So young people do want to quit. In fact, more than 50% of them want to quit. Other programs that we've got is our college program. Again, great support from CBS since we started, focusing primarily on HBCUs, historically Black colleges and universities, minority-serving institutions, community colleges, places where the tobacco industry has relentlessly targeted people. We've helped over 120 schools go tobacco-free. That includes vape-free. So it makes a huge difference, protecting over 1 million employees, faculty, as well as students. And then, the last facet is we now have a high school curriculum called Vaping Know the Truth that we're rolling out to 2,000 schools. So we're trying to hit it from all angles. It has to be multifaceted that way. And I can hold out a little bit of good news that it's going to take some time, but I think we are making a difference.
Yeah, I want to get to Bonnie on some school programs too, but Sue, do you want to talk a little bit about your programs?
Absolutely. And CVS has been such a great partner in allowing us to create curricula for medical professionals. So the American Academy of Pediatrics is really focused on making sure that all pediatricians and pediatric providers are well versed in what vaping is and how to address it and why it's so important to continue to address it every single year that we see the kids, because they don't have the right information because they're bombarded with social media and misinformation. So we need to make sure that we ask the right questions and that we give them the information that they need. And for those that are vaping, that we offer help and help them with something meaningful. I send lots of kids to the Truth Initiative and to This Is Quitting to let them know that there's something that they can do on their own. And that those kind of curricula and those kind of information guides that we provide for pediatric providers have been critical. And we also provide information for our pediatricians and healthcare providers that they can partner with the schools. And Bonnie's going to talk about the schools, but the schools are a critical place because that's where our kids live. We may see them once or twice a year in the healthcare setting, but that's not enough. We need to catch them where they live. And so these partnerships are absolutely critical so that we catch them in every single place we can find them and make sure these kids know that there is no safe vape and that there's help to be had.
Yeah, that multidimensional aspect is so critical. We really have to come together. It's not just one interface, it's a variety of different throughout the kids' day. And Bonnie, I wanted to come to you on this particular issue because you've been very successful in the education space. And how have you seen the outreach of these types of programs adjusting in terms of COVID now that everything has to be virtual?
Yeah, it's a great question. It's been a hard program, or hard thing to deal with. So we have the tobacco prevention toolkit that, thanks to CBS, we've been so successful with in being able to launch across the country. And in doing that, our original curriculums, and we have multiple, we have vaping, we have other tobacco products. And typically what we do is we educate the educators to use these curriculums in the schools. We also educate parents, and we're starting a new initiative of educating providers, healthcare providers as well. What we had to do in March, as soon as everybody went remote, is we actually took sort of the best of our vaping curriculum and went remote. And a lot of other programs have been doing this as well. So we gamified and put everything online in a way that either you can have youth doing a self-paced course, so they can start at the beginning and do it themselves, and then educators can see the test results and the certificate at the end. This is for mostly prevention, but also we have a version where teachers can follow along and actually teach them during Zoom or whatever method they're using, or in a hybrid class if that's what's happening. So we were able to, in the toolkit and other programs, to pivot. We also have it where we are also doing webinar trainings to educators and parents online to really help them understand this information. So I think it's going well, but it is hard. It is definitely a pivot, but it's been successful, thankfully.
As we noted throughout this session, much has been accomplished in a number of areas over the last several years, but creating a tobacco-free generation requires resilience, that's for sure, particularly now with COVID, and determination to address the ever-changing marketplace, and vigilance to reinforce the prevention message and the solutions that are available to young people. So Sue, terminology is important in reaching and engaging with youth. What have you seen done successfully, and what advice would you give to parents or healthcare providers looking to reinforce messages in an effective way?
So it's a really important thing to talk about. We need to make sure we're talking the same language as our kids. And our kids and our young people are not calling them e-cigarettes. They're calling them vapes, or they're calling them Juuls, or they're calling them Stigs, or whatever the product in your area is. So what I encourage when I'm teaching people around the country, I say, go to your local shop and look and ask at your local convenience store and find out what's being sold, and ask the young people directly, what are people vaping around here? Because then you get a lot of good information. I know there's a lot of regional preferences, and that matters. And so a lot of times the kids will call them the brand name, and they may not be right. They might say, I'm juuling, but they're actually using a Stig or a different brand name. So it's really important that we use the language of the kids and really ask those critical questions. Parents also, to Robin's point earlier, need to know what they look like. And some of these smaller disposable products are very small, and they really do look like a USB drive. And so they could be very easy to mistake. So just recognizing what they are and making sure that we speak the right language and terminology is indeed very, very important.
Yeah, I think it's critical. And I know, Bonnie, you have that point of view too in your curriculum, and that terminology and the conversations that we're having that bring that sense of urgency and perspective. Do you have a comment here?
Just that I absolutely agree. And I think it's really important for parents to also understand how these products came on, sort of snuck along with social media, and how small they are. And that's one of the things, is not only pointing out the language, which I completely agree with Sue, but how easy it is to hide these products, how easy it is to hide the smell, how easy it is to hide their addiction at first. And so I think giving parents kind of permission to understand that it wasn't their fault. It's not necessarily the kids' fault either. This product sort of came about with not much information, like Robin was saying. And our studies show it too. We just don't understand these products. I think that's why it's so incredibly important for us to give honest information with pictures and language and words to help parents and educators and youth talk to each other about this.
Right.
I think it's important.
that peer-to-peer conversation too. Robin, the conversation that we've had, and we keep talking about it, multidimensional stakeholders. There's got to be this cross-section of stakeholders to move the needle here. Everyone has a role to play. What do you think is the most important call to action for business leaders, for policymakers, and community leaders to make strides here to help reduce this overall vaping rate?
Well, there's definitely enough work for everybody. Certainly on the policy side, there's a lot of work that needs to be done at the federal level. The last 4 years, frankly, have seen way too little action. What we hope for with the new administration is that we can finally get these flavors off the market, all of them, that we can get the regulations right so that they don't create loopholes. Yes, the Juul pods, the flavored ones, although menthol was left on, which is a flavor, the Juul pods were taken off the market, and that gave the perfect opportunity for products, these disposables, puff bars, Stig, you've heard us mentioning them, smoke, on the market. They have to go. It has to be consistent. These products should be regulated before they get in every kid's hands, not after. The states are actually doing some great work. California, Massachusetts, New York have gotten rid of the flavors so we can take guidance from there. And I think, for business, there's a lot of work to be done too. I mean, clearly there's decisions to be made, such as CVS made, to get these products out of the stores. Accessibility, availability is, kids walking to school and seeing signs plastered in the front of stores creates a lot of demand. Partnerships, we partner, in addition to CVS, we have great partnerships with Vans and the NFL and Petco and the Girl Scouts as well, other nonprofits, ways to bring the message to young people where they live. And retail, brands that kids love is a great way to do that. And then finally, one of the things I'd say that businesses have an opportunity for is their employees. We know that a kid who lives in the home of a parent who smokes is more likely to vape. So helping your employees quit is not only good for their health and, of course, for businesses, for their bottom line, but also will help kids stop vaping. We have a program called the X program, which is an enterprise program targeted to business and to third-party payers to put at scale programs that work. We've got over 6 million people who've been helped with X to quit and to quit for good.
Great. Perfect. That was a great way to end this session. We are unfortunately out of time. We appreciate all of our guests for helping us. And as we celebrate 5 years of Be the First, we recognize that we need to continue this work with others and in collaboration and cooperation with others, because we are focused on helping deliver the first tobacco-free generation. Thank you for your attention and your time. And for more information on this work, you can go to www.cvshealth.com. Be the First. Thanks so much. Appreciate your time today.